Famble them, good afternoon and welcome to the Wel Bodi Tok program where they come to you live from Radio Maria Salon, the Christian voice. Now you host, as usual, with me, Gifty Masakoy, and with me today, after a long while, we get Dr. Samuel Bela with me for Can Talk for Wel Bodi Tok today. So start this program in the name of the Father, and of the Son, and of the Holy Spirit. Amen. So, Father God in heaven, we say thank you for today. We say thank you for the gift of life. We say thank you for the weather. We say thank you for all what you don't do for. We commit this program now you can. We pray for viewers and we listeners. They will make all this prayer to Christ our Lord.
Amen.
In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Family members say you they get to live. Now we 4th floor studio. Now 10 Santano House. 10 outfits. Now 4th floor studio. Now Santano House, 10 outfits. Now Freetown. And you dey get to live now with frequencies there 90.9 at Freetown, 101.3 na McKinney, 91.7 at Bo, and 90.7 inside Kenema. Remember, say you can reach out on 079-9009077907 or 0773155147. As I said, the program today, I get Dr. Samuel Bela, will always be my co-host. But because of schedules, they promise in the reach, but finally today they inside Freetown. Last week if I don't do it, but the weather Ola because of the area where they not get water. So today then we talk about something very important, but picking them. You go to ask if it's possible for let picking get dry cough. You go to ask if picking get maculates for dry cough. You go to ask if it's possible, how you go know. So all landed inside this program today, we will look at pediatric tuberculosis. So stay with me the next 1 hour for me you learn about this condition. Dr. Bill, I go tell viewers and listeners how to.
Viewers, listeners, radio.
All right, welcome back. So today we will look at pediatric tuberculosis, dry cough inside picking them, waiting another one day.
Dry cough inside picking them. Now, the bacteria or tumbu, where the same tumbu where it cause dry cough, big people then, and the same tumbu where they are picking them. And most people then can feel say, picking, now they get dry cough. Indeed, picking they get dry cough. And as we go along, we see waiting at some of the way picking get dry cough, waiting they show, and how you be able to know. But picking dry cough, normally they salon. This is the thing where I will begin tell you that it is salon. And we will work now the Wel Bodi Ministry, more where we do what they call a program, TB program, with more concern for the picking dry cough. Because we don't find out, say, picking dry cough, they but people then for let them able no say it did then also let them diagnose her even at the health facility. That is a very big problem. Or will not they pay much attention there for let we able find out the picking dry cough.
Well, body workman them gets plenty work for do for picking them, and picking them get boku sick them we maculates the effect against, and one pandem at this dry cough. But if possible for the picking still get dry cough. And not only in other countries, but Salon said get them. And for that name, Dr. Bela there for talk about that because it belongs to that program, the national program for leprosy and tuberculosis. So we don't know now say picking, then they get dry cough, and the same tumbo where they cause them from big people then, and the same one back they cause them from the small one there. Now we go and know the target for TB inside Salon. Same way, so we get statistics, but it's secure.
Okay, the Salon, at the now to Salon, the whole world will get over 1.5 million every year they is sick of dry cough. But like Salon, we get up to waiting the World Master Sabi, what we call a World Health Organization, waiting until we for dry cough. Generally in a Salon, we for always get about 24,000 dry cough patients then every year, 24,000. But out of these 24,000, Peking alone, will they get up over 3,000 out of that number, 3,000. So it's like 4%, around 4% sort of. So 3,000 Peking every year will find out and show that they get that dry cough. But how we go find out? We get various other means so we know whether it's Peking dry cough. As we go there, we go able to know. But the statistics they tell we say, WHO they tell we say, every year we make sure say we find out and we get 3,000 Peking where they fall sick of dry cough.
People go and clarify that side. May we is it a projection where World Health Organization don't give say inside Africa 1.5 million people impossible from waiting we don't observe say some say they live in a good house or they not take macro or they not get this impossible say 1.5 million every year impossible for me to get dry cough. So out of that the post alone 24,000 out of your million population will get possible for me to get her. And out of that one day 21,000 if possible, yes, out of the 24, if possible for the 21, dry cough all big people then. 3,000, yeah, 21. For that dry cough all big people then, the 21,000. Exactly. And when the 3,000, if possible, because the way you talk, I see WHO confirm it.
Now a projection.
So we have to be specific in that one day. Now a projection. Yes. That if we not take the steps, if we not see say picking for take macrates, we everything for go take the macrates, or we make the macrates they are available, or keep the macrate at the correct chain for me and get them, or try for trace the picking them, outside and they for me and take out if they on treatment for continue this that. WHO don't look at and say inside we own country another amount, that thousands of numbers for the big one then 21,000, the 3,000 we account for picking them, and picking them will not say, and then they take after we. So anything will not tackle now at the age, they will get for Ambogwe in the future. So I just want to clarify that side.
Sister, thank you when you bring out the points there. You know, WHO than the whole world, then they give targets to every tuberculosis program in any country. In fact, for the whole world, we get 30 most high burden countries in the world. And out of that, the whole world, there are 30 high burden TB countries then, Salonde among. So inside the whole world, we count from number 1 to 30 countries then, we then get the highest burden of TB, Salonde among. So now in Salon, the whole WHO and other world organization, health organization, and it takes Salon very serious in terms of TB because we are among the first 30. We WHO they say they get high burden of TB cases. And out of that, Salon, now the same WHO give that target that we for FENA, we for always get like the adults 24,000. Out of the 24,000, generally for the TB cases, we will for target, we get 3,000 also for target for picking them. But we SSF as a country will not do any prevalence study in that area. They will sister the try for say, well, we will show say this not the exact or very close, and this will for find out. So in fact, that is one of the reasons why the program don't decide say in subsequent maybe one in the next 1 to 2 years we'll therefore do prevalence study of TB in our country. So in that case, we will be certain as to whether the number weight of WHO they give as target will they nearer or will not they nearer, or when we see say okay this is the right one when we don't get now from the prevalence studies, be it for big person or for picking them, we'll get for do that. But for now, what is WHO give we as target? Now I don't tell you.
All right, thank you very much for that clarification there. So also, Salon, we somehow they be small when it comes to research.
Yeah.
So this not a gap where we need for work on. So you they do your master's program or whatever in Wel Bodi business, if you see this as an opportunity, but look into the prevalence of tuberculosis from picking them or from the big one there or for Salon in general.
Yeah.
But let you see if that target rate of WHO say we have 24,000 per population, if applicable to we, or if we don't pass that number day. So now you open for we, for let we know say we get more for do not only they rely on waiting the other overall Wel Bodi person they say, but we set need for know about
your own country, yes.
So that's not the target for TB in general, and the 3,000 is specific to picking them. Now we go on know waiting how picking and they get this dry cough.
Fine. Before we go to how picking and they get, you mentioned something very quickly, the way you say they give them maclate, or we don't get for cancer prevention. But I get for clear and here now that the maclate where would they give the what would they call them BCG, would they give picking at birth. Then not to a license for say where you give that picking day, you not will get TB at all. Within that vaccine they do, even if you get up, it they make the sickness not go severe for that picking day. Now the reason that they would give TB vaccine so that in case the picking get up, it not go be sick, not go able to overcome it. It go able withstand that, then it will grow well. Then the person way you not get the vaccine at all, where that sick, where the dry cough sick cola, it will end up maybe if we not take active which is a diagnosis or so, it will end up for we lost that picking it.
Okay.
Yes.
Mm-hmm.
So now you tell me, you talk about
the
mode of transmission and how picking they get this sick, this dry cough sick. The key thing how picking they get this dry cough sick now from definitely a caregiver or a mama, or if any of the person they within the community or the household where we don't fall of this sick, picking can easily get her from that person where we don't sick before or he get the sick where they are monger, or even in caregiver or in mama or in papa where fall the sick. So that's not the reason why we can even decide for give them that vaccine they at birth. Now we imagine so there's somebody there una all in the same neighborhood or they una in at the same house. And they cough, but una not don't ever prove say whether they get this dry cough or not. Una bring that bikini the born and una bring inside. In fact, the first thing where they go begin kiss at first. Then of course we don't say dry cough sick it they pass now through ear where they cough from up. So bikini where the don't just born then, what you call the soldier man then, when the immune system, the soldier man then at the body where they make they prevent them from letting them not get sick or let sick not hold them, not strong. Then just born them. The immune system not strong. So any other sickness where they are around them, they can easily capture them. They can easily get them worse inside them. So now one of the things that the one way will they get them through airborne way is the picking, then a community or the environment or very close to the caregiver where you get that sick, it will get her. Yes.
So humble now that, yeah. And same way, so think even the environment, congested places, the maclate as doctor don't say, then this minimal handling. Now make most in hospital, then you always talk and they say, where you go now, not so all man for this speaking because all the maclate so the for take, you know don't take them.
Mm-hmm. So
you get for build up that soldier man. And now that key thing again where you say, and not mean say where you don't take maclate, that make you 100% protected.
Yeah,
it's possible say you go get 90-something% protection, and the few percent you can be exposed to that condition. Just that how it will attack the other person will not ever take the maclate. It will be very, 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 very less. The kind of way they attack you because of you don't already build some other soldier man there against that sick. So that's the mode of transmission. Doctor don't talk about. If you just join the program, this now Wel Bodi Tok. Yes, doctor.
Before we go further, the mode of transmission. Most people they feel say dry cough is supposed to get dry cough. It's not near you. We're not for each together. We're not for share a cup together. Or even if eat inside plate, you don't for touch that plate. No. Dry cough typically now it move inside somebody. It contract through airborne. Where that person now the cough where they cough near you, it go inside the ear You inhale that here, it pass through your nostril, then your nose, it go inside your fuk, what we call the lungs. Now, in fact, the dry cough bacteria, that tumbo, it only grow more than the lungs, than the fuk. So because outside oxygen here and so forth. But if a cough inside food, you even touch her, you're not going to get dry cough through that. It pass through your nostril. Some people can ask, if somebody cough inside the food, I eat her, I will get her. No, if you once you put her in your mouth, it go inside your belly, you're not going to get dry cough through that. Until that bacteria go inside the ear, that ear they you inhale, it pass through your nostril, it enter your lungs. Now they it begin grow. So now from there now it will spread now all the side of the body, what we call extrapulmonary. Because
that just one take me to the types of dry cough. For let people know say the one way specifically where people know about now the one way they affect the lungs as you explained, so the pulmonary TB, but we even get tuberculosis where they affect other parts of the body. And that doctor just say.
Yeah. So that how then the two types we can normally diagnose most frequently in this country now, the pulmonary and the extrapulmonary. But the pulmonary, as sister don't say, is very common. Now we know, but people know when they affect you, what we call the lungs. Then when you inhale, it go inside the lung, it pass through your nostril, it go inside the lung. Any other bacteria where they pass through your mouth, if by mistake it pass through your mouth, it go inside your belly, you know it die the instant. In fact, one thing I will try to tell everybody for letting you know, the TB bacteria itself, that tumbo, is so weak. Even ordinary, in fact, some now bomb for her. As you exposed to the sun, it kill her instant. As you expose outside, it doesn't take long. 2, 3, 4 minutes don't kill her. Once it don't go inside the lungs. So now, in fact, that's the reason why we can say, like sister mentioned just now, we are not in a congested environment. Because if somebody gets this dry cough sick, una in a closed environment, as they cough, that they go out. It's possible that once you get close to them, if they inhale quick, then it go inside your lungs, and they begin growing. But once we can always say, let me place suicide, the window they open, here they flow in and out. As it come out, once it not go inside any more time, within a short period, it will die. You know they able to circulate to other person. So now that we always ask people then, not in a closed environment, congested environment, and even if we are in a congested environment, if we see somebody they cough 2, 3, we don't get all kind of antibiotics like picking and I will talk about it. You don't care what the hospital say, they don't get all the things in there, the amoxicillin, augmentin, and all the rest. After 2 weeks, they still cough more. Go investigate for TB. The same thing for big person.
Thank you very much, Doctor. If you just joined the program, no say this now Wel Bodi Tok, where they come to you live from Radio Maria. Today we look at pediatric tuberculosis, when a dry cough inside pikin them, and inside the program we don't look at waiting na that problem they where they affect pikin them, and waiting as Salon you target. Salon they among the first 30 countries then where
get high body,
get yagba, where the whole world for Wel Bodi visit they look at and say them for pay attention to our way out of the population. They say and say 24,000 of the population for be targeted. Way out of them, 21,000 are for the big one and the 3,000 now for picking them. And today we look at the picking them because the picking them so German not strong inside them. They can take maculates with them both, but yet they're still exposed. Or yet some mama not still care them picking and go for maculates. Or we also look at the different types. You say it can be pulmonary where they are born with fuk in the lungs where you can get into airborne, or extrapulmonary can affect other parts of the body, can affect the bone stem and all. But all the one and the way they get the problems, they go see doctor and they tell them go able for diagnose or tell you say na TB the picking gets, but na the way they are bone and all of the one and they just that we commonly know the one where they affect the lungs, where they see the person they cough and all of them things. Now we don't look at the mode of transmission, how it gets away. Doctor already talked about the airborne, but yes, inside less than 4 minutes, that tumbude can die if somebody not inhale am or come in contact with them and all. And also it depends on the person waiting na immune strength. Almost soldier man the get for faith, then kind exposure the day. So we want to look at the causes them. We don't already begin to talk about like overcrowding place and all other things. Doctor, I don't know if you get more for add to the causes of dry cough is that.
Yeah, one of the key causes of dry cough. Now, when since beginning they get low immunity, the soldier man and they're not strong yet. So easily, if that bacteria enter there, it will multiply. They will get dry cough. Then two, like HIV, Peking when they born out with HIV, we already don't get HIV, it prone for let it get TB if we are not preventer. Because the reason being that HIV it reduce the immunity of even adults, let alone Peking them. So when TB almost it is thrive well in waterman or Peking there or even big person where the soldier man there they don't weak. And HIV now they make you soldier man there and the body weak. So if you weak, TB is a very good environment down there where you go say, oh, this I go strive there very well or I will do well there. So that I go there. So for Peking back where then the born from HIV mother or HIV parents. Now they go easily if you are not watch them, they will end up for get TB. Then also the other way how Peking they get TB, the cow I don't just stop. If the born like what sister don't say, they not easily mark later. They get high chances for develop TB as early as when they are speaking, because but that vaccine when they get it help them for like a strong and even be soldier man against the bacteria. If any other dry cough tumor they come inside body, it go don't meet soldier man already they don't build up, so they go fight against that, so you don't go easily get her. And even if by chance they get her, like what sister say, I'm over like there's that 15% where they left. Because 90% or to 95% no go, you not go develop dry cough. But in case it develop, it's not the worst part. So that is the other way. Then of course, like what we don't say, Peking, the soldier man they're very weak. When you born Peking, in fact, that's the reason why they can always say, as you born, this is the first vaccine that the way they give, that vaccine where they give for prevent dry cough. Now the first vaccine that they way they give, and it always they insist as you born at birth. You don't have to wait until maybe after 1 month, 2 months. No, because the moment you don't born that Peking, in fact, the first cry when they cry, now here it is here. Not so you know, get my master Sabi midwives there. So the first ear they get for inhaler, and that ear there you don't know what it is around it, because the bacteria maybe they are around. So that ear when they inhale, if I go meet already something for the day we go protect them. It go even open in lungs. Now they open in lungs because when they born begin that in you not open it. As he cry, he inhale that first ear. Now the they open, they begin breathe for himself now. So within that cause, if by any chance he inhale that bacteria, that dry cough bacteria, it go grow. So now that make you always see, give them from the first day where you born now. So that before that ear they go inside now, they go not meet soldier man, they don't now they fight against that. So then are some of the ways that we begin to get. And then of course, like how they say, when they're born in Africa here, we use it as the mom picking for the play with her kiss, you don't put more than they enjoy there, or even cough panel. No. Mostly they're also in a congested environment. I can always advise it. When you born picking, okay, you born in a hospital. When you go in a house, make sure say if crowded at that house, that for that moment they not a very uncrowded place where crowd not keep walking. And even if crowded walking, make sure say una open. Let the place aerated. Let it open the place, breathe for the flow in and out for protect that skin. Thank you.
And I think in addition also malnutrition self contribute.
Yeah.
If the beginner they eat well, because if the beginner they eat well, certain sick they able for better.
Yeah,
so the beginning
right.
need for the eat well, they need for the drink well and all. So malnutrition self gets involved properly. So if you get the opportunity for getting picking bobbies, you go to 6 months, then here on the bobby, where you know say will be lot more soldier man there. before you begin get other milk, and also we begin eat the family meal. Ensure say the pikin get all wetin e take for let able for well, and let able for grow fine, and let able for build up in your soldier man dem for himself. Then we go to the wetin how person go know say this pikin don get dry cough. Wetin are the signs and wetin are the symptoms dem?
Yes, sister, thank you very much. One of the key, because we get series of signs and symptoms wey begin to show say e get this dry cough. Say one, e dey always develop fever, but that fever dey dey turn like, because somebody go ask, all sick dey carry with fever. Yes, all sick dey carry with fever, but like TB in own fever, e no turn like malaria in fever. E no go be so hot, because malaria the whole process you don't take time. If you no go treat am, the fever will rise up so much that it will even lead to convulsion. TB in your fever it look mild in pikin as well as even the adult. But the only thing they ever done, if you not treat the TB, always it come on and off. So tell all the interrogator pikin in body one. They able to talk like how big person they talk, but all the answer in body one. But the one to that extent where it show say it go into convulsion. That is the kind of fever where this dry cough can give pikin. Then the second point, cough. One, we don't talk about fever with the one body, and that one body it look mild, but it continues. You get any kind medicine, you always they show up. Then the other one, cough. It's pikin, not all cough. I go say you go tell say this pikin don't get dry cough. No, it's pikin cough. It begin cough. You will carry and go to hospital. Then get all the antibiotics. So then we will begin get like amoxicillin, because that are IMNCI protocol. Yes, where after 1 week you go back. This cough still dey pana. So then they put that to cefixime now. Then cephalosporin, high level drugs and now. Still the pikin after normally waiting with this after 2 weeks and more, 2 weeks and more, that pikin dey cough, and body still dey warm. You don't get all the antibiotics for cold, cough, subside. Go investigate for dry cough for that pikin. 2 weeks and more, pikin dey cough. You don't carry and go to hospital several times. All then after 2-3 days you carry and go. You don't move from this hospital to this hospital. They don't get all the tough cough medicine there, cold medicine there, nothing. They don't get all injection, nothing. Go make them investigate for dry cough. I'm not saying that dry cough you got to, but go investigate, because other sickness they know they come. Or go pull down the under. Yes. Say, okay, I don't pull dry. We don't do dry cough. Not doing. Then the third point is you always see that again, failure to strive. Waiting the midwife or the medicine we call failure to strive. That picking. So then you can see like then 6 months, 7 months. You see like na 2 months picking. You feed them all kind of food. You give them all kind of support. You give them bobby. You suck continuously. But in body not define. Because they tell you don't reach there 9 months. When you go come Italy, you go fix in a 3 month picking. So then they even by then you not go down sit down self. You not go grief for sit down. You not go grief for play. You stay in it. Then another sign, failure to strive. In fact, now make even now one link the nutrition department with TB.
Okay.
So we get that collaboration. Now the nutrition units or EPI, when they go for vaccine, when they take their weight, then let we know if that picking with time, they show that good growth. But all day they complain of fever, cold, cough. We need for go do a test for TB.
Okay.
We want to do that kind of collaboration now. Then nutrition, once they go nutrition, they always malnourished. They strive well. We need for investigate further for dry cough.
Okay.
Then the other one is, generally picking them, they play pass mark. And when they play pass mark, even small picking, when if not 3-4 months, why you don't begin recognize person as you should wave your hand to her, they go smile. You see that kind of gladness panel. Then all time it look agile. Let alone the one we don't go now, and they play for itself. But once you don't see picking, you don't reserve. it cool down. You know, they see the play smack down, the way you use for play, you get then you get all the other side there, but they want small, it get the cough. Sometimes you don't cough for long, go investigate for TB, for dry cough. Yes. So these are some of the time for particular picking. You get for look into the signs, and then if that happens, go check for dry cough.
So these are some of the signs where you, the mama or neighbor, go see or you observe from the pikin. So if you say the pikin body the one with all the medicine the doctor don't give or the hospital always don't go, with the malaria always if you say now, because most of the people don't suffer, big people as well as small people, them they always think say the only sickness alone are malaria and typhoid. Yes. So that can even make some man they even get problem with any of the other organs, in kidney, in liver, in hearts, and all, they know, because you just take and say the malaria and typhoid. Once you don't take the set of treatments, you see say better not that you need for go further. It don't mean say that you can go and rule her out. So if the pikin don't cough for about 2 weeks and you not cough so no more, you don't they take medicine, they don't they take all waiting and say you don't use all waiting for use, then you need for take further step. You see say the pikin not they go as how you they expect her, or you see the left body, or you see not they eat well, or you see they get out one body altered. All of these now concern with all which you don't hear. So now some of the things in this way for be concerned for you. So doctor, then with all this, we don't know the waiting at this dry cough, we don't know how they affect speaking there, we don't know the message where it go send for no say na question mark for go do test. We don't know the side the way they are more. The most common one are the lungs, and you get other parts at the body where they are more. Then so with all these things, people will take say na malaria, na typhoid, na this, na that one day, na titi they pull, exactly. Or you don't expose under fan, or you not be wear socks, you not be wear cap na they go get all kinds of excuses. Yeah. Mama be the drink, ice, this. So we told them that day we don't know the signs and symptoms there, but the one key thing will make we really specific say that like cough is speaking gets not the diagnosis. So waiting na the thing the way the mama or the parents they will expect the kind test they go do for the pikin.
Initially, now this country will not be really get a specific test for picking it because it's difficult. For big person, will be the say let them cough, then they go watch the cough on the instrument what they call microscope. And even of late, one machine can what we call gene expert machine. When a machine that the way it is diagnosed for this dry cough, the first stage of that dry cough what we call the drug sensitive TB. It is diagnosed, and then now of late it don't they almost diagnose. It don't they diagnose multi-drug resistance TB. The gene expert.
Okay.
But even that we will get some challenge with them because for pikin they not they able cough. You even cough past like pikin we don't big small now. That way you force them, but then they said maybe the cough not the kind of way where you go expect them for them. Okay. So it's difficult, especially baby then. Baby not they cough so no more. So we not really get actually way for diagnose them with this machine. So waiting first. The clinicians and the doctors then they do, then they just watch their signs the way I don't show you. If every day they get this pikin go, even nutrition, they don't say this is malnourished, they grow well, and they cough continuously, they don't treat all kind of antibiotics. Waiting now the first thing what they do, then they go put her on symptomatic based on this clinical diagnosis.
That was one body.
Yes, we can't overload it because of the clinical signs and symptoms where the pikin don't show. Then they put her on treatment. And in most cases, we see and say maybe good number of them kind case them where doctor they diagnose clinically they strive well, they do well. But now we get one key thing. Of course, X-ray was another one, but mostly they kind of beginning they do X-ray panel. They don't really do X-ray panel. Now, big people in the morning they do X-ray. That's another way of diagnosing TB because if it affects the lungs, when they show, the way it don't show inside the lungs, once the clinician able to read the X-ray very well, it shows this is not TB. But picking them, now also a challenge for do X-ray. So now we don't get way how they diagnose this TB in Pekin.
Okay.
We use the same machine, whatever, this latest machine, we can the gene expert machine. Then they use the stool.
Okay.
The stool now, where easy forget for Pekin. Then or they can use the gastric. They do gastric lavage.
Okay.
Then that gastric liquid, then they pull out inside the belly. They can also use that for test. But most commonly, the stool now, they use, because gastric lavage, it look technical. Again, all them things. But most often now, they use the stool for tests for beginning.
Okay.
For this dry cough. So that's two more they use now a gastric lavage
and
the signs and symptoms.
Okay.
And even the signs and symptoms now, what we encourage clinicians to do, if you use the signs and symptoms for put that Pekin on medication, then not to consider say, oh, that will not do the gene expert.
Okay.
Because initially you can put them, why the gene expert test? Because the gene expert, though it is in every district now, but not in every hospital.
Okay.
So why you wait for, based on your clinical judgment, you don't put that patient on the drug. Also, you get for collect the stool for go to gene expert. In fact, I go advise you before you begin put on treatment, use or to take the stool first, then you put on now why why the stool, I mean the gene expert result they can now, you can put the patient on the treatment. If the result come out negative, then you can stop the treatment. But even if you put her on treatment, make sure that they go do that testing.
And it's free?
Yeah, the test of course is free. And inside TB center there, like
so site specifically the regional hospitals?
They are the regional hospitals. Every regional hospitals now. When you go to Bo, it is a Bo government hospital. If you ask for gene expert machine, they want to do TB test for it is Fritaya, in fact it is Connaught, it is in fact PCMH.
Okay.
All are doing. In fact as I speak, we don't get a request now from Massive Ship.
Okay.
Whether they Macaulay speak now. In fact all the patients and the pediatric patients now, they go for the center now. All are doing. Yes, for do the test for them.
Right.
The machine they did. Yes.
So it's only the machine, or they need specific things? They need any reagents or?
Yeah, the program now they provide all that they get a cartridge, what they call the gene expert cartridge.
Okay.
We give free. In fact, we always supply them. Now they center them. As they done, we replenish them. Because like this year alone, the latest supply we can for the gene expert cartridge for the gene expert machine, we brought in about 25,000 cartridges.
Yeah, since the target now 24,000 of the population.
Yeah.
So the 1,000 in case we get some challenges.
No, sometimes challenges. In fact, they even plead that the hospital should always go with light, let them not cut off light. Because if that machine they run, the power cut off take place. Maybe if the machine not get UPS, they go within that short period, pass they take other sample. That cartridge don't waste. So now that make we encourage in fact that's the reason why we not even ask them for put on all the like the PHUs or what, because of the
specific side.
Yeah, they are them big hospital centers.
And they have been trained for the
we have technicians.
Okay.
Gene expert machine technicians.
Okay.
Where they're all trained, they're well known.
All right.
Yes, in fact very recently almost every year we do refresher training for them.
That's fine. All right, so we go before we don't know now say first time we will not be they do that. Now waiting at the complaint we'll treat you by them. But now wait on day for me you test. So we will go and are free. So let we say now the Pekin don't do the test, they don't do they taking stool or they don't take something from the belly, the gastric lavage. Let we say now the results a positive when we say the Pekin gets the dry cough tumbo in body. So how the treatments in Tale?
Fine. The Pekin in treatment, it just sounds like the big one in the treatment. They get their own drugs. Oh, they bring a Pekin drug for dry cough. Una the same name there, like how the big one, they own name then. They rifampicin, the isoniazid, ethambutol, pyrazinamide. But then your strength, the strength alone, you know,
Okay.
you get, if like the adult they take like 400 milligram, the pikin they go say 100 milligram.
Okay.
So we get when they bring that kind pediatric dosage again, the pikin a young dose. Dosage with the counter and the pikin a young tablet to the counter.
Okay.
In fact, like most of the tablets that will the counter for pikin, then dispersible. You can easily dissolve it inside water, then drink it.
So,
Yes.
so the picking the your medication, no, they come in any injectables.
No, not for now. We don't get
For
any.
now,
In fact,
for now,
generally
orals.
TB for now oral. We don't get any
No
injectable again.
injections. Okay.
First time that we give them streptomycin, but we
Okay.
don't. In fact, over 4 years now, we know they use streptomycin again.
So it's
All now oral
by
now.
month.
Yeah, by month now. And then they take her for 6 months. The beginning is the same thing 6 months, except for like extrapulmonary. Extrapulmonary cases, because the sickness don't come out of the lungs now, so they don't wear inside the bone, or it don't go to the spine, or it don't go to the meninges. So that one, and they, if they diagnose her for as extrapulmonary, sometimes they extend the treatment to like 9 months.
Oh wow.
Yes.
Okay.
So in that case, now that but once not to extrapulmonary, now pulmonary, we give only 6 months. Why are they on that treatment? Almost every month, and they go test them for CC, they monitor her for CC the bacteria.
Yeah, because I just want to ask, is it that then they go one off for the supply, or then they can't the every month when they can now they give them the 1 month supply for long, able to do it for long, because normally I think say this medication be dot direct observed therapy.
Yeah, now
so how now it is.
Fine. It is still the policy still says dot direct observed therapy.
Okay.
But because of certain challenges, this like somebody they live now, let's say Crobola.
Yeah.
Crobola is one I was just there about 2 weeks ago.
Oh.
That's one of the farthest distance from Kabbalah alone to Crobola. It's very close to almost about, because from Kabbalah to how they call Mongo is about 70 something. And from Mongo to Crobola is 100 and something.
Yeah.
So very close to 180 miles from Kabbalah to Mongo to Crobola. Now, but the good thing is Falaba is now the headquarter town of, we get Mongo. I mean, Mongo is the headquarter town of Falaba district.
Okay.
So we have another machine there. So somebody at Crobola now can get access to the gene expert machine at Mongo.
Okay.
But Mongo is still far. It's about 110 miles or 108 miles from Mongo to Crobola. So in that case, you don't go expect it and diagnose speaking or once with a dicop for the car every day for taking a medicine.
Okay.
For 6 months. Or even if you can't do in Fambu, na Mongo. The longest time that Fambu will encourage us to say 1 month. They go, which they, once the beginning don't begin grow better now, you go say, hey, let go back because I don't think I end up. Now the same thing with the get na free tire. Some they come for take treatment there, or so then they all are doing. So after 1 month, in fact, all are doing go don't discharge them. Who side they go for good day? So then the who side they go there to the Fambu, they don't get better place there.
So the ideal is
the ideal,
observe
not,
therapy,
yes,
but because of other challenges.
Yes, challenges with the give, normally sometimes weekly. When it starts initially, the drug providers they give like one weekly they go. But as you don't pass like the intensive phase, like the first 2 months, I would call the intensive phase. Then can they give you now maybe monthly, depending on your situation. Not that.
And this drug is free of cost.
No, the drug is free.
The lab,
no cost attached to it. The treatment, the test is free.
Okay.
And even the doctors then when they see the nurses then by right now free.
Okay.
Yes, all with treatment sites.
All right. So in line with this medication, all medicines get side effects. Are there any specific side effects of them? Dry cough medicine where parents they need for know, or they could already advise them when they for return with the picking immediately in our hospital in case they see ABCD signs, or no specific.
Yeah, no drug, no they will not get side effects, and most times then side effects it only become prominent when you don't use that correctly.
Okay.
When you don't listen maybe to the advice of the clinician, what did they tell you, or the doctor, what did they tell you, or whosoever the pharmacist or so where they tell you say that's so you take up. If you don't follow that, if you go overdose yourself, you will get more side effects. But notwithstanding that, most drugs, they still come down with side effects, even if you take them the correct way. So the commonest side effects that we can see inside the TB now, like peripheral neuropathy. What did that mean? A very big word. And the nerves, then the peripheral nerves, then they weaken, or then they hamburg. Yeah. So sometimes, if na big person said, if they feel say something na needle the chuchuka, or something where they waka. Most times you don't let big person. How you go able easily know? You don't give this medicine something to big person for like 2-3 months. So then the other one now, when they can't take in supply, if they see that they work with difficulty, they say, doctor, all this may food under, why they step like now, then sometimes if a nerve, okay, the same thing goes for the kidney, even the development kind of thing. So we call it peripheral neuropathy. And one of the drug where they inside, one of the components of the TB drug where we could call it isoniazid. Okay. Now in common side effects so it can develop that kind of thing. But we get drugs where we can give them, where we'll reach there, we will talk about that. We get also advice we give. So always we tell without provider, they tell this person, this caregiver for them to care. If they intend to care, develop this, they can tell you. But now with the even advocacy, we're not going to wait till let the pikin develop that level. What would they do? Would they always give now the drugs with the cantarada effect together?
Oh, okay.
Together.
Which one are they?
Would they give pyridoxine?
Oh, okay.
Pyridoxine, in fact, one of the TB preventive therapy.
Okay. We
therefore give pyridoxine now, isoniazid and other. We'll come to prevention. We'll talk about that. Okay. But one of the drugs now will give for their side for overcome their side effects in the pyridoxine. Okay. We always tell you say picking, maybe you will get like half, because a 50 milligram we can always count with now. But we can get to 25 milligram for picking it. So if you don't even get the 50 milligram, you can divide the 25 milligram, you can divide the 50, you give the picking every day, once a day on that drug. Oh, okay. The same thing goes for adults. Oh. The advice now, they take 50 milligram of pyridoxine every day for avoid that peripheral neuropathy, when the commonest side effect where you see. Then also we get the other drug where they show side effect where it looks scaring, but if you don't tell the parents, it will stop the drug, or it will say, oh, this drug don't make me begin the wet with blood, because it is scared. Okay. Me begin nobody take this drug, the wet fine, the wet clear. Now it don't begin wet with blood. What they call the rifampicin with the inside. Okay. The side effect today, it cause coloration of the urine. Red coloration of the urine. Mm-hmm. Even in adult people, then in fact that can scare some adults. When they don't dey on that treatment, maybe after 2, 3, 4 weeks, the urine, whether they go wet now then they see the urine don't color like blood. So then the phrase is now blood in the piece. So then the wrong go, they begin, if they don't be done educated, they will phrase them first, they will stop first the medicine. So this medicine is something I didn't give me this problem. So you get to tell the patient, or you get to tell the parent, say, this medicine, one component the way they inside when rifampicin, will they begin give this to the kid. But once after 2, 3 or 1 week, if they begin see the white don't change you, it appear like red, not red. Yeah, don't consider for care. You know, they get nothing to do with that thing. So these are some of the common side effects.
So Kamala, I hope you listen today. I there with Dr. Samuel Bello with the tell you about pediatric tuberculosis when I dry cough inside and picking them, we can work them. And inside the program, we don't talk waiting at this dry cough and waiting at the targets for salon. And same way, so don't look at waiting the cause and the types then, and waiting at the signs and symptoms and how we go diagnose this condition inside picking them and how we go treat them. And we just don't talk about waiting at the side effects of some of them medicine there. So as time be between now, doctor, waiting normally can be the outcome. The cases them we don't be treated with their medications, they are waiting don't be the prognosis and
the prognosis very good. In fact, a very good question this way you asked me, Sister Gifty. TB generally is well king, and in fact from even the program level at the ministry level, the experience, the prognosis of TB is almost, I can say, 80 to 90%. Very good. Once they take the drug correctly. In fact, let me say one secret about the drug. The drug so effective that even if you begin give that pikin no more from 1 week, 2 weeks, getting to 1 month, in fact the pikin will pass now like it not get nothing. In fact, that now the challenge that they even get with the adult. As they begin, because when they go seriously sick, when you don't begin take that medicine. Once they take it every day, like how they tell them, after 2 weeks to 1 month, then they feel they don't wear. Like even if somebody sometimes if you come up like village, you come for treatment, it is now they go back, I don't feel right. So sometimes we go now, it is default because you say I don't wear. So none of the other problems. So because the medicine is so effective, within 1 month at most, you don't see say the pikin will recover again. You know, in fact, the good thing about it, within 2 weeks, 14 days. Now you say, why would I admit TB patient again? When see, but the one where is severely ill, where you need admission, other sickness with that. But now once now that TB, once we give you that for maybe even when you in a house with your family, we will tell you say just take some precaution, some IPC measures. You take that medicine for 2 weeks. After 2 weeks, it's even very difficult, even if you go for transfer that bacteria again to other person. So the medicine is so effective if you take it correctly within that 6 months. Why would they give up to 6 months? Because the tumbu, not to inside the blood no more it can don't well like how inside the lungs it don't form what we call latent TB, or it don't go to the bone and other side there. Then medicine then therefore we therefore get time for well inside or the inside and the inside the blood it clean up totally. So now would they give up to like 6 months. But the first 2 months is very effective if you take a they even transfer and give other person again. Until you don't inside you.
So that's not the good news. You will get TB or you will get family will get TB or get PQ will get TB. No say once it go early, then diagnose them, then treat them, and it constantly they take medicine at the right time, the right dose, and how they tell them it go working.
Yeah.
And now for let me wrap up. We'll go and look at in addition to the maculates, the BCG maculates, we can normally partake as them born and so. And also we now want for link up the the Wel Bodi nutrition and this EPI. Waiting at the other additional things them way parents them or people the way they listen go do for me them go prevent this dry cough for people.
Yeah, good. One of the first thing we do, if we are in a host, any adult you suspect they don't get TB or anyway other relative don't get TB. The first thing we will go do, where they don't do on immune treatment now, then we get for do, they will do what we call contact tracing. Then they get for look at all the people that were in them, they interact with our family or inside our household. We get the definition. Now, the CAWs would they even train them for let them go do that contact tracing. They make sure say if that picking by that time don't show any sicknesses. Would they, if like in mama, let's say in papa or in mama or in uncle, or in our house or in brother, he don't sick. Would they go take that picking and the immediate close contact then?
Okay.
Would they go? We test them. The one then where if they fall ill, them become positive, would they put them straight away on treatment.
Okay.
The one that will like where if that picking there among where a negative, we're not going to say this is negative or just left and so. We go try for preventer because until the thing they in the latent stage. So we call what we call TPT, TB preventive therapy.
Okay.
Yes, and TB preventive therapy the drugs in now would call them 3HP, then isoniazid and rifampicin. We get the way how we give them for 3 months or 6 months. So then we can give some 6 months isoniazid. So that isoniazid will make the pikin a preventer for lead, even if we don't take that bacteria, the bacteria no in the latent stage, it not begin cause sickness for it not will cause sickness again. Okay. Or even if you don't get it not will get it again because we don't put our on preventive therapy. The same thing goes for adults, but pikin them more than anything we do for them. We make sure say we use TPT. The policy they now, okay. How we get for the one, some picking they will give them 6 months, continuously, that isoniazid 100 milligram for 6 months, or 50 milligram for 6 months, depending on the situation.
So depending on the situation, so we continue for advice now for carry pikin and go for market where they just born, and same way so for reduce minimal handling, make carry pikin eat very well, avoid overcrowding, and also try for make the pikin eat very well. If you get any sick or you know say you know okay with go with an hospital after so many treatments so you don't get you know okay with a go with another doctor then do test and try for rule out dry cough or any other thing where then we go for advise you. Because the earlier you go, the better. Doctor, so they wrap up the program now. You can tell people then waiting and you take home message for the parents and caregivers and the clinicians.
Okay. Me take out home message for picking and more is that number one, if you find out say anybody there around una environment or una home where you don't cough continuously for picking and maybe una self day, make sure let it go to this test, especially if you don't tell you say you will not tell us that you don't get to. But once you don't study and say you don't treat them with all kind of medicine, antibiotics, you know well, you advise that you don't cough 2 weeks and more. You advise that let go do this test, and the test they all over and are free. They cannot, they 34, in fact, they all over the country. They go, in fact some facilities they get up. They let go do it. Then the second point is picking them. If that person when una don't say if it become positive, make sure say that una all una there around, including the picking them, let them go do tests for them. They say na free. Once na contact them, when you don't make sure say they don't get at all again, put them on the preventive therapy. Some they put her on depending on the age, so say for 6 months. Depending on the level we gave for 3 months, so let them take that preventive therapy. It on now. Then number 3, allow you environment overcrowding, and even in okay enough like Freetown here, sometimes it is very difficult to avoid overcrowding. But no day you overcrowded and you in a congested place. Always some people and they go take 1 week, they not open the window safe. So please, when I go to open a window then. Let breeze go to blow. TV, you know, like also elect is a tight place elect, so that it go strive well. But once here the flow day, it pass free and fear. You know go to one place. And as you exposed to in fact like some na bomb for her.
Yeah.
Then even if you for not grown, where they you know even take 2 minutes they die. It's so weak. So in the defense side will strive very well. So now then key points in they always make sure say picking we cough more than 2 weeks. You don't go with an this hospital from hospital to hospital. After 2 weeks they still cough, they get small fever, they lost weight, they lost appetite, then they reserve to himself, they play, go with an hospital, let it test for dry cough.
So now the order from Dr. Samuel Bello, I just go add say in line with nutrition, I think we left out one thing before they wrap up the this milk they give the picking them, especially I think the from the north I think they get cow milk.
Yeah, cow
because
milk.
one specific one are the bovine TB.
Bovine
TB way they in line with that milk day. So you get to be very careful and how for process and well for the picking we go for partake of farm. And also the Wel Bodi workman them you we want take care of sick man, not say them for go to hospital. But if at all you think say now also you don't treat them because of your lysine, you still say they're not they improve, no continue for treatment say malaria and typhoid, make them go to hospital and go do further tests. The tests not free, the medicine not free. And not airborne. So let we save with community, let we save with workplace, let we save with family, Wel Bodi, and agency.
Yeah, sister, you touched something very, very important. We the head Wel Bodi workman they all treat people there. If you don't see say picking, you don't get all kinds of them treatment that they know well, not just in a pneumonia, but send her for let do this test.
Yeah.
Use yourself then you very relief.
So always go do test because that's fever but other sick, cough, fever plenty other sick, one body fever plenty other sick. So if you don't see say you know they feel better, go and do the test then. When you do the test, you then at the right time for take the right medicine. Because don't even say in time to come some medicine and get for be resistant, you let you take them, they're not they work again. So let we give time for the medicines there for work. And for tell Dr. Thank you and one of the viewers and listeners and for give a story inside this 1 hour. One for tell Dr. Thank you and we left on now in the name of the Father, of the Son, and of the Holy Spirit. Amen.
Bye bye.